So extramedullary disease has been a poor player, and it's been a well-known fact. Even with the novel therapies, patients with extramedullary disease do much less well. Now we know CAR T has had impressive results in response rates, depth of response, and in progression-free survival. And the question in our minds has been, is it going to perform as well with extramedullary disease? And so that led to this retrospective chart review. So we essentially had 86 patients on this study, um, and 49 patients had relapsed after CAR T. 23 patients had extramedullary disease prior to CAR T, and 20 patients had extramedullary disease post CAR T. So we found that the median progression-free survival was shorter, as expected, for patients who had extramedullary disease at about 12 months, at a median follow-up of about 33 months. And for patients who did not have extramedullary disease, their median progression-free survival was about 20 months. But interestingly, what we found that of the 20 patients who had extramedullary disease, um, post CAR T, only 10 of them had extramedullary disease prior to CAR T, so that's about 50%. It was a little different when we looked at the bone marrow statistics. 31 of the 36 patients who had bone marrow involvement post CAR T actually had bone marrow involvement prior to CAR T. So that was interesting. Also, we found that 70% of patients who had EMD positive prior to CAR T and then relapsed post CAR T actually had their relapse at sites of original disease, and so only 3 out of the 10 patients had relapse at sites outside of the disease. We also found that patients who had extramedullary positive disease post CAR T did much worse, with a median progression-free survival of 6 months, versus those who had extramedullary disease negative post CAR T at about 25 months, and that was statistically quite significant. One other thing that we also found very interesting was that about 35% of patients who had extramedullary disease relapse actually were bone marrow MRD negative. So this was also very interesting, that bone marrow MRD negative was not a good indicator of relapse. Yeah, so that's something that I think we're really thinking about, because if 7 of 10 patients had their relapse at sites of original disease, then you think theoretically that should be preventable if we're able to maybe sterilize that area prior to the CAR T, maybe add some radiation to make sure that we add some additional, disease control to decrease local recurrence rates. Another interesting thing that we also saw was that 12 of the 23 patients who originally had extramedullary disease actually were extramedullary disease negative post CAR T. So that's over 50% numbers. It does seem that CAR T may be effective in extramedullary disease. So I think that one, it's very interesting that CAR T seems to be pretty effective at eradicating extramedullary disease to a certain extent. That perhaps because a lot of the relapse was at areas of original disease, that maybe we can try to improve upon that. It's very interesting and telling that patients who have extramedullary disease negative post CAR T actually did much, much better than those who did have extramedullary disease post CAR T, making it increasingly important that we should try and sterilize those areas prior to CAR T. I think it's also very telling that 35% of patients had bone marrow MRD negative at the time of the extramedullary disease relapse. So it's important to have both serial PET imaging as well as bone marrow monitoring for surveillance to make sure that we pick up all these relapses. I think the two big things that we're really thinking about, one is maybe see what if we can improve the decrease in local recurrence, and secondly, in really so we and secondly, really making sure that we do that imaging surveillance in addition to the bone marrow and not get comfortable when the bone marrow MRD is negative. So obviously, this is a very small group of patients. We want to now, see what with bigger numbers if these kinds of findings are still holding true. And so I think that's one thing. And the other is really trying to perhaps add radiation to, particularly to areas of bulky extramedullary disease, and see if that improves the outcome any. No, just that I think CAR T is a very nascent field in myeloma. There's a lot of exciting developments, but we now have to learn how to use this powerful tool much better and just get the best bang for our buck.